honestly, like the idea of a test bed, we've gone through the individual research programs, but to actually have someone to test it with, to help you get it off the ground, to make the first pilot, to make the first measurements, it seems easy, but it's not. Like AI basically crashed and burned twice in the 70s and basically in the last century because we didn't have the mechanisms, the machines to run it on. So please, please use the opportunity, go see Luigi. And that was a wonderful thing that you just mentioned about collaboration, because this is a beautiful segue, by the way, again, thank you, into the next section, which is on the panel and the importance of interdisciplinarity. We recently had, a few days ago, one of the inventors of the double helix has passed away at the age of 97. There was actually a huge controversy, though, because they used some of the research done by one of their colleagues, Dr. Franklin, who actually made a lot of the measurements, who actually made a lot of the pictures. But Watson and Crick were just very, very clever about actually putting it together and omitting some of the researchers that should have been part of the paper, actually not making them co-publishers of the paper. And there was a lot of bitterness in the community, and that was just the double helix. Now think of the quadruple helix. And you think that that might not exist, but it does exist, and it is the invention of CLARA. And the quadruple helix is something that we're going to present to you right now in the high-level roundtable discussion. The theme is AI and brain health, so quite simple themes, really. Building trust through collaborations across sectors, because for a humble archaeologist like me, all of this is extremely difficult, but I do understand one thing, and that's humans. So if we want to get things off the ground, we got to talk to each other. We can't be in silos, and we got to talk, cooperate, collaborate, and that's what this panel is going to achieve. So let me please, slowly but surely, invite the individual guests on the podium with me. The first is the panel moderator, Dočkal, the director of INDRC, or as we colloquially call it, INDRC. Please come on stage. Round of applause for Vít. Thank you. If I could have, in quick succession, Jana Hlaváčová, the Ministry of Health of the Czech Republic, the section of legislation and law. Thank you very much. Welcome. I would shake your hand, but very, very busy here, so I'm sorry about that. I will do so shortly. Next, if we could have Tomáš Lapáček, CEO of the Prague Innovation Institute. There he is. Good to see you again. Come on stage with us. Then we have Petr Braťka, the Unit of Preclinical Assessment, the Czech Metrology Institute. Where are you, Petr? There you are. Welcome. Then we have Olga, sorry, I'm moderating this like an MMA match. I apologize, but it's just so exciting. Olga Štěpánková, head of the Department of Biomedical Engineering and Assistive Technologies, BEAT. We also had Dominika Synkova, who due to very difficult family circumstances, unfortunately can't meet us today, a practicing psychologist and CEO of Genesys Medical, but we've got a replacement, but it's more than a replacement. It is Dr. Ira Hebold Haraldsen, the head of Cognitive Health Research Group, Oslo University. Welcome. Right, I will love you and leave you. I will give you a microphone and enjoy the quadruple helix.
Yeah, so I will be a moderator for a second. Philip, you can join us as well, you know. I don't know what you did to, you know.
I'm so sorry, he's not in my notes.
It's okay. It was just, you know, it's our fault. Thank you. Hey, welcome. Philip, a business guy, you know. We were speaking about business, so he's a business guy from IPO Lab and INDRC and CLARA, so that's it. Thank you, sir. Yes, welcome. I hope that you are all having a great time. We actually heard a lot of science, and now let's speak how we can collaborate all across the sectors and this multi-stakeholder collaboration, you know. And I have some tricky questions to you. The same to you, 4 questions. Maybe different answers, maybe the same, I don't know. So if we may, for example, start with the interaction of all of us, you know, and what we are doing to help patients with AI and emerging technologies. May I ask you?
Yes, of course. Thank you very much, and thank you for the invitation. I am from the Ministry of Health, which is not always the most favorite stakeholder to have on a panel, but I have to say, especially in the Czech Republic, we have such a distrust, maybe halfway earned, halfway not. But what we do as a Czech Ministry of Health is that the first and foremost responsibility is to be a good regulator and to make the playing field even, to do the rules of the play, but also in line with comes from the European Union, the AI Act and the other digital acts, but also what we can do is to coordinate, to be the platform where the stakeholders meet, because in the end we are the ones creating the legislation that should be based on the interests and needs of different stakeholders. We are trying to help, especially our Czech health facilities, healthcare facilities, by issuing the guidances. They are very new, maybe you haven't heard of them yet, or some of you, but we have one on administrative use, one on use in clinical performance, and one will be for the management. And then it's the information that we should give to the sector. So we have a little web page with the FNQs and education. It's like a lot of little things that we, as quite a small state, can do. But I would say, like to collaborate so that the environment in the Czech Republic is enabling effective and safe implementation of AI in health.
Thank you.
So I will just start with, first of all, thanks for the invitation. On behalf of Prague Innovation Institute, I can just briefly talk about what we do for the patient, because we try to put the person in the center, like a human-centric approach. Obviously, our agenda is to find the disruptors, find the innovators, and we scout universities, we scout, but also younger people for their ideas, and we try to help them scale it and maybe find a business model there. But we are also, since we are like a city institution, we try to help the regulators, let's say, on the side of the compliance. So we try to also look for processes, technologies, best practices from maybe also outside the Czech Republic to be implemented, that the disruptors are kind of in a collaborative way incorporated and the benefit is trustworthy and stable. So that's basically our two sides. We also want to actually embrace and get involved the civic society. So we also organize this. We are going to organize platforms, matchmakings, networkings, where we disseminate about it's like a general knowledge, what to expect, what are the rights, and help with explainable AI mainly, because this is the topic of this panel. So these are the three main pillars in relation to what we are going to talk about today.
Thank you very much. Ira?
I'm not so afraid for the innovative part, but we should not forget when it comes to AI to reach the patient. The majority of the world has not even access to MRI. The majority of the world is dying still of infections. So it's all about to develop interdisciplinary concepts of equality and how the better developed countries can take their responsibility and share infrastructures which poorer countries are not able to finance.
Thank you very much.
Hello. On the beginning, maybe I should answer your question, why somebody from Metrology Institute is speaking here already now. Okay, once you produce the software regarding this AI, regarding this any diagnostic functions, regarding, for example, the beta amyloid and Alzheimer's disease and so on, in principle, it's software as medical device. So it falls under the MDR regulation, yeah? And the Czech Metrology Institute is the notified body for MDR. So we assess your technical documentation and your quality system, and to enables you to enter the market with the end product. So how we can help, or what we can do, we cannot advise you, but we can hold something called like a structured dialogue. Yeah, we can explain you the requirements of the regulation, and we can in some ways help you to fulfill these requirements. Yeah. So that's what
and that's very important, basically. Once you pass this border, then Philip comes, you know, with business, right?
Yeah. Good afternoon, Enrico. Thank you for the invitation. Regarding IPL Ventures, so we essentially what we do. We recognize that there are many groundbreaking technologies at universities and at institutes, but they are essentially, especially in this region, kind of stuck there, and they need help to get out and actually change our lives for the better. So what we do, we work hand in hand with scientists and institutions to build spin-offs and spin-outs, essentially startups out of these technologies, including but not limited only to biotechnologies, projects including AI, but in general, kind of technologies which can better our lives, our individual lives, and our lives as a society. Really, I think right now we are also trying to figure out the way how to harness the power of AI in individual specific instances, so that we make our lives easier and not more difficult. Because I think this is also one of the risks we are facing.
Thank you very much. And last but not least, Olga, academia.
I'm supposed to represent academia, but of course we have heard about academia and its result, supporting CLARA's goals and intentions for last 2 days. So I'm not going to speak about deep research, but I'd like to mention that what is really important for usage of the results is user-centered design, which we should take care in as well. And of course, there are also some less sophisticated things than, supercomputing and its algorithms, because of course it could be also considered to utilize some technical devices in home environment and in care as much as possible, because care is outside of Industry 4, another topic which needs a lot of repetitive and very difficult and boring work. And we have to do something against that.
Thank you very much. So how can we actually collaborate? How can we benefit each other in this multi-stakeholder environment? I don't know if we can get a presentation. That would be fantastic, because we have maybe challenging questions to you. I don't know if you can post these questions to that screen so you can see it. So the first question, many patients fear that AI could replace the human touch. How can we assure that technology strengthens, not weakens, the trust between physicians and patients? So who would like to start? Maybe Ministry?
Well, replacing the human touch, I may speak now from the nowadays point of view, which is what we want from the AI and its deployment in healthcare is actually to give more human touch. Because if we can save the repetitive issues, the time, and we believe that then clinicians and healthcare professionals in general will have more time for the patients, for the things that they really should do. That's why the focus on using the administrative technologies that can be weaken the administrative burden that is there, so that they really can give their time. Then we have to acknowledge that now it's the clinician that decides. So far, and maybe we'll see in the future, but nowadays it's assistive tool. So it is really the responsibility, and the human touch and human decision is always there. And what we can do about it is that we really build it around the person, so the person-centric approach, the user-centric approach, and of course, and I don't have a crystal ball. So far, the machines are doing, for example, the second readings in the imaging technologies. But then, if the technology will go further and harder, We need to make sure that, I know the word regulation sounds a little bit, not that nice, but actually it is. How can we make the environment so that we have the human touch, in my sense of human rights protected, that the safety of people is there, and so this is my answer for that.
That's great, thank you very much. Maybe Ira would like, we don't need to keep the order because it's okay, but Ira, you're from the sector, you're providing the service.
Yes, but I would turn the question around. I think the patients should be more afraid of a single doctor to meet. I would say that the bias in us humans is big. AI can help us to become better as humans. It can identify the bias easier. We heard now just from our conferencier about a Nobel Prize which ignored the female behind. This is important that this is in the future not happening with our patients. And then on the other hand, PhD students, in our case, for example, at our hospital, studied, originally educated in AI, they have to meet patients so that they understand for whom they are developing something. And the interdisciplinarity demands communication from both sides. There are not the technical experts which arrogantly can develop algorithms and then are not responsible for what they are doing. It's the opposite. They have also to ease the burden the doctor has to carry. Because if I'm using an algorithm and I am predicting wrongly, it leads to a legal consequence. The patient has rights, and these rights have also to be discussed. Who is the provider? Who is the developer? Who is responsible for mistakes?
Thank you very much. Maybe a regulator could add something.
I'm not sure if metrology or regulatory science have these answers. Therefore, I asked my wife, because she's the neurologist. So I asked her, and she said, I think it's not about the matter itself, it's about the presentation. For sometimes, at least, there will have to be the man in the loop. So I have to present to my patients that I am here for them, and my expertise and my human being is 100% here to make validation of the outputs of the AI. But I have really powerful, as was already mentioned, really powerful, precise tool which can really help me to make the better curement for you. Yeah, so I think it's in the presentation.
Thank you very much. What about business perspectives? Either you guys?
Yeah, I think it was pretty much mentioned here, but the first thing is definitely kind of the administrative burden. So I'm right now involved with one healthcare project, and the amount of work actually individual doctors have to do, and the amount of documentation they have to go through and see through, and and correctly interpret is just staggering, right? And if we in some way can lower this burden and make it easier for them to actually understand what's going on and what are the potential diagnoses and how they can approach the problem, then we will free up a lot of their time to actually focus on the patient and also work with the patient in terms of some kind of individualized, personalized medicine. And I think this is one of the angles we perhaps haven't mentioned in like specifically here. But I think this is angle or vector towards which we need to start moving, right? Because I think right now also many diagnoses or if a doctor diagnoses a patient, I think still they are drawing upon, well, what's the most likely diagnosis, most prevalent in the population. But I think we need and we should get more and more specific what is suitable for individual patient. Obviously, there are blockers in regulation, so this is something we will also have to adjust to going forward. But yeah, I think those other topics were mentioned.
Thank you.
So I actually translate human touch as basically creating safe space that every organism needs. And for me, it stands off obviously on the side of the patients and basically everyone involved. It's the literacy. So there needs to be literacy about broadened, deepened, and for that you need leadership, because that needs some money, considerable amounts of money need to be devoted to that. And obviously transparency as the same. Again, very costly. AI needs to be explained, explainable. There need to be due diligence about, like, because safe space can be only established when there is a trust in, and then I think like everyone will see AI as a tool. It's definitely only a tool. People will still crave the human touch, whatever it is for each of us. But there are some preconditions for that will be costly, and without leadership, it will not happen.
Thank you very much. And Olga, how is human touch embedded in the science and technical development?
I'm sure that one of the responsibilities...
I think it's on.
One of the responsibilities of producers of different devices which are being, recommended by doctors to their patients is to make these, devices as reliable as possible. But of course, because we as people are, are very different. We are very individual. And it is not easy to fine-tune the device with respect to the needs of individual patients. So personalization of devices which will be recommended by doctors should be as simple as possible. And this is also something we should be responsible for, because this is not the task for doctors. They should spend their time with people, talking to people, but not looking and searching for the way how to somehow fine-tune the device.
So plug and play.
Yeah. Thank you very much for this, and also for the patient-centric approach in here. I hope I'm not overstepping, but also I was very glad to be invited to this panel because I wear two hats. I am a patient with multiple sclerosis, and I work for the European Multiple Sclerosis Platform voluntarily, of course. And I have to say it's so great now to see that what people, the developers, are really speaking about, having patients in the team so that you can listen to their needs, that I feel that we are there. Even in Horizon projects, with even if we design a study, that we really are present. But this is something that we need, like this continuum to go on, to have the beneficiaries of the system, be it patients or be it clinicians, who have in a center. That means having them while we are developing the policies, the infrastructures, or the devices.
Yes, thank you. It's a very important point. Actually, patient advocacy groups were invited to this panel as well. They couldn't do it, but of course. But yeah, it's very important, and therefore we have so-called CLARA Collaboratorium, which is actually these kind of things, not only across sectors, but how to actually foster the innovation with co-creation aspect. So patients need to be there, not only to co-develop the things, but to actually trust these innovations. Not to be fair of that innovations, and this is very important. Thank you very much, this is important. Okay, I think we are on the same page for the first question at least, so maybe, yes, so maybe this would be a different story. Each group, government, academia, business, civic society, wants something different, Innovators want speed, regulators want caution, physicians want safety for their patients, the public wants transparency. So how we can do it together, Okay.
Okay, thank you very much. I think that the way and only thing we can do, or we should do as the first step, is the really early dialogue about the framework. Yeah, I think because, for example, the regulation or the metrology can gives you data standards or validation benchmarks, yeah, and the metrics, yeah, that should be then used by the producers, by the developers, and also by which leads to safety and so on. Yeah. So I think that we should really early start the dialogue about the framework.
Yeah, if I can.
It is great, maybe, it's great because, we offer the service to regulators and public authorities. We as CLARA, because we can provide you public consultation and, feedbacks for the regulations in every stage. That's what we can do. Thank you.
Yeah, definitely. I think kind of open communication channels across individual stakeholders. That's, I think, the critical part. And I think it's often, so there are different platforms, right? Different dialogues going on, but I still think it's not enough, and we need to have this in a formal way, but also in an informal way, right? And all, I think, parties must be genuinely interested in what those other stakeholders kind of are trying to do, right? Because I think that's what we see sometimes, that even though we feel that we have open channels, but the other party is not trying to understand us, or kind of like we don't really speak the same language, and this can be only done through really having informal discussions and really trying to move things forward together.
Yeah. So this is a very difficult question. I think we all know what we want, like to have these goals really aligned and to have the regulatory as fast as possible, not to stop the progress, because we also live in a competitive world. And so I think I really agree what has been said, that even in the policy making and the regulation making, we need to be participatory. We need stakeholders, we need to hear them, we need to have these platforms, and we need the ability to understand one another. And I think this is the goal that I think that we are trying to achieve and that we are doing. I'm 100% sure of my colleagues from the State Institute for Drug Control that are now like part of the regulatory when it comes to the MDRs, on the medical devices and IVDRs, and that they are really doing a lot to be there also for the developers by offering the consultancies and so on, because it's quite difficult now when, and this is a lovely thing, when new actors are coming to the market, which is wonderful. What we should do is to make sure that they have the information and the consultation to do it, because the regulatory in healthcare is unbelievably difficult when we go into the regulatory and getting the things on the market, and then when you need, or when we are speaking with the finances about the reimbursement, whether our reimbursement schemes are enough or not, and whether we suffice with them. So one thing is that I do believe that we work together on this, that we have the multi-stakeholders platform, and if not, please come to me, find me, and we can work on it more. The other thing is the capacity of the state sector. Now, I'm not speaking about my colleagues in the State Institute of Drug Control, but from what I see from the ministries, from the state sector, is that our powers are diminishing because there is not enough investment. It's a tragic situation, I have to say, with no sufficient financing so that we can be competitive in having the brains, in having the people who will be partners to the developers. And so this is something that I cannot be optimistic about. We will try, but with this approach and when we are heading, I'm very, very worried. And this will affect everyone, even the progress on the market.
I would just, obviously, we need framework because we have at least like 4 main sectors here, so they need to be framed. For that, you just need leadership, and there's the politicians who need to set the culture, and we want that. They don't have to be experts in that. They just need to be like, we want that, and we actually set the expectations of like all the beneficiaries from both the economy or the public budgets, like what to expect, what is actually being penalized and what is being rewarded, like what actions. So it's the motivation. Obviously, for innovators, we need to start more like creating sandboxes, like safe spaces for experiment. Regulators, they obviously want caution, but they are also the ones close to the leadership. They should work with creating like a common language so that and it's usually translated into some goals. We want like the best for the people under this and this, these and these conditions. And obviously public, it's the feedback loop. So the public actually feels on board, and it's a participatory. All of this needs to be not just first innovation and then regulation. It needs to be like, let's say, co-evolutionary process. Like, and it's actually not that difficult. It's just about the culture, and that's all about the people. So the human touch will define whether we will have like more human touch in the future.
Yes, thank you.
I think we should be alert to have fast-track MDR regulatory processes ongoing, because the field is developing so quickly and we can't allow ourselves years of approval. That one thing. The other thing, we have to make risk group decision makings. Some attitudes are less risky or decisions than others in medicine. So, for example, in Norway, all bone fractures are automated, evaluated. None is done by radiologists any longer, meaning if there is a negative result, meaning there is no damage in the bone, then the radiologist is the day after looking through them. But the positive ones are all automated, going to emergency then and so on. So there are areas where it is easy to introduce AI, and then there are complex diagnostics tools which may be considered with more carefulness. But we should become more flexible, and the bureaucracy has to develop themselves as well. And maybe also younger people with AI background need to come into leadership. I think the biggest concern I have are typical bureaucratic hospital leaders. They are not equipped to lead us into the new age, and they have to learn fast.
Thank you very much. Olga, you were laughing. Maybe you can add some your experience.
Maybe we should pay attention to the fact that all the four in this group have the same aim. The aim is to produce reliable products, something which will help us and make our care and everything more efficient. So if we want to produce things like that, we need to do real-life testing. And there has to be much more open space for pilot experiments, for pilot testings of the products. We can't wait until it is confirmed by all the stages. And of course, this pilot testing has to go in different sectors. A different type will go in healthcare and different one in social care. But it has to be considered, and we have to somehow support it.
Yes, and we are lucky, Olga, that we are actually building within the CLARA testbed the assistive living lab here, just at this building, you know, to actually test and validate new machines, devices, software, and approaches. So basically, this could also help, right?
Sure.
So when we can expect the grand opening of the assistive living lab here within CLARA testbed?
Certainly before the next AI days.
Wow, that's great. Thank you. We are looking forward to that. Okay, everyone here wants to help the patient, but each sector works differently. What's the thing your sector does best to improve the care, and how actually we can use the benefit of these emerging technologies from your perspective?
So we do the best. What we are the best positioned, and that I think is really like be the one that is in the middle, that is listening, that is providing the platform, that is impartial, that is unbiased, that hears all the stakeholders' needs and wishes. What we should do the best is really do the playing field, work on the rules that should be fair, and also I think we are very good positions to, maybe best position, it's our duties to make sure that we are equitable or that we are fair in the benefits that AI brings, that we don't discriminate based on whatever algorithms and the buying power of the people, that we don't work so that the disparities among people are larger. But I would say that really we should do a lot of work on having the platform, and through that and through the collaborative approaches and participatory approaches, like really do our job and do the regulation that will fulfill our goals, common goals.
So I think each sector should do what they're designed to, like business offers agility and implementation, people in the society, some empathies, academia brings sort of truth. And it's like a lot of like different, our role as the innovation centers, that we are tasked to be kind of like interpreters between these carnivores, omnivores, vegans. And our role is to help them find the common language, and that's what other innovation centers in the country and better also outside the country do. So this is what we are designed for. Obviously, the level of our success is also reflects the maturity and the inter-institutional relations which we work on, and they are definitely getting better each year. So, but we will still need some time to see the full results. But I'm optimistic about where we are heading now.
In medicine, we are always very good in innovation. We are born as innovative people, doctors. We innovate constantly and make decisions without knowing, always. So we are intuitive professionals, but I think we are good already in planning surgeries, needed personal employees for the weekends and so on. All these kinds of services, we are good already integrating AI. And that we could maybe give away as an experiment to other areas. And we are good in thinking, as I mentioned, in virtual fantasies. We always have been such analog products and professionals, so that we could contribute maybe for other sectors.
I think this is very important because intuition is definitely a part of your practice and part of science as well. I'm wondering how intuition could be embedded in regulatory policies and practice.
On the beginning, I would like to point out that we are not the rule makers. Yeah? So if you think that the regulation is tight, so please call the European Commission, for example, via the Ministry of Health. Yeah? But how we can help? Regulation can help too, yeah? Because we are excellent in setting what the reliable or the safe means. Yeah? So we can help with the setting of practical rules, for example, for quantification or assessment of uncertainty, because in principle, the measuring function is the prerequisite for any diagnostic function you are talking about in your softwares. Yeah? So uncertainty, and also, and I think this is the way we can help the mostly. Bias definition or the acceptation limits, if any bias would be accepted, yeah? And also the big issue is the reproducibility, yeah? Because all these systems are in principle stochastic, yeah? So we have to really prove according to some KPIs and so on, that the results are reproducible, yeah? So, and I think that this is what it's not about the tighter regulation, but I think it's about tighter standardization. Yeah. So, and that's what we can help.
That's important. These metrics would be very valuable, even in setting the scientific protocols and then the MD protocols. So, if you can share with us some kind of metrics to train some self-assessment, trustworthiness application, that would be great. Guys, Philip.
Yeah, maybe just very quickly. I think also when we are talking about business, I think there are different segments or subsegments of business, right? But if I look at it from the standpoint of startups, I think they are very good at coming up with potential solutions to all kinds of different problems across different segments, and in healthcare and medicine, definitely. I'd say less or more crazy. Then we somehow need to see through that and understand, okay, which are viable and which are not, and kind of getting it or operationalize it, right, or execute it. I think the challenge is actually to validate it and see, well, is this useful or not? And especially in healthcare, this is challenging because, first of all, obviously, kind of safety and then security of patients is coming first. And then we need to be very careful about what we put into practice, even to the validation. And the second thing is the validation or the results, the actual results of the validation are often delayed, right? Because it's different if you're testing a chemical catalyst and you immediately see if it works or not. But if you are working on a blind clinical study, then those results can be really delayed and takes a lot of time and obviously money to see what works and what doesn't.
Thank you, Olga.
Well, it's quite difficult to think about good answer to your question. It is a hard question, but I believe that besides all the theoretical results we have heard about today, we should also mention that we as scientists are people and patients as well. So we should be all the time aware of the difficulties which our environment in hospital, in doctor's office or anywhere else have to tackle. And we should be all the time prompt to try to come with some solutions and search for the way how we could support. And this is probably our duty.
Yes, thank you. Okay, so we actually are running out of the time, but last question, what can we do together? What can a single action we can do together to really make use and benefit of all these emerging technologies for our patients? So very short answer, please.
Cooperate.
One single action.
Cooperation, that would be it. Maybe.
Yeah, there is not really a single concrete action. So, if how I see it in 5 years, it's like we have great data operation. We have like really due diligence with AI. We have the right amount of regulation. We have very agile and very fast knowledge transfer from science to business, and great and active. We have like a single market and single capital market in European Union. That's a really big thing. So without that, I don't think there will be like achieved what we would like to see.
We should demand implementation in clinics, and that together with the regulators.
That's great.
Just one thing that I think that we all together should build up the transparent and really robust validation ecosystem for these systems. It really helps to any of us.
Okay, I will throw in a little bit of a curveball. Honestly, we need to come up with a way how to make AI less demanding on kind of like the computational power less demanding in terms of energy. Because if you've seen that the demands of AI for the computational power is just growing exponentially, and we need to figure out ways how to make it much less computationally demanding. We're actually looking into one of these projects, or actually correct finite fusion, but I don't think that's happening in the next 5 years.
Thank you, Olga.
Well, I think that the best is to meet, to cooperate and to talk to each other, because of course in the interaction is the advance. We have to talk to each other, not just via email, but meet and ask questions why you need this and why you don't do this. And I think that a meeting like this is a perfect occasion for that.
Oh, that's great. Thank you very much. You know, actually, we are coming to the point that we might think and consider to establish, as we are sitting here, the organizational multi-stakeholder committee for CLARA Collaboratorium, to actually launch this collaboration. If we want to collaborate, we need to communicate. So let's start with this. If you would agree, I will create a mailing, and we will have another meeting offline to discuss how we can move forward. This is an action plan to start and launch this communication. And these metrics would be valuable. Your experience from practice is incredibly important. Business, money, comes always first, and that's it, And you can oversee it. We can join the public consultations and everything. It's great. So you have a clear action plan. The second, we are looking forward opening ceremony of the CLARA testbed node here at CIIRC, the assistive living lab, where these innovations can be validated, tested. Again, you can oversee before it's submitted to you. And then we can really celebrate the science and innovations which hopefully would enter the market and our patient needs much, much earlier than today. Thank you very much. And maybe I would give the floor to Sarah again. Thank you for this powerful discussion.
Thank you so much. Thank you. Please give them another round of applause. Thank you very much.